Hello and welcome to Module 1, Lesson 1, What is Integrated Care? This is the first module and first lesson in the Integrated Care for Behavioral Health Paraprofessionals course, which has been developed by the Grow Our Behavioral Health Workforce program of the Center for Health Innovation. The purpose of this lesson is to provide an introduction to the concepts and practice of integrated behavioral health care. Learning objectives. Students who successfully complete this lesson will be able to define integrated care, describe the 3 steps required for a practice to provide integrated care, discuss the benefits of integrated care, and discuss the challenges of integrated care. Keywords that you should look out for as we're walking through this lesson are bidirectional care, behavioral health, integrated behavioral health care, patient-centered care or person-centered care, and patient-centered medical home. Lesson outline. We'll approach this lesson in the following way. We'll start by discussing what is integrated care. Secondly, look at what is needed for integrated care. And third, look at some challenges to integrated care. We'll conclude with a review and lesson summary, and then don't forget to check your understanding in the accompanying quiz. You can take the quiz as many times as you want. You do have to pass it with an 80%, but if you have any questions, please don't hesitate to contact your instructors. Section 1. What is integrated care? Integrated behavioral health care brings together all of the healthcare workers who are caring for a patient into one team to address the patient's medical, behavioral, social, and other needs. In advanced models of integrated care, patients receive care for all of their medical conditions and behavioral health needs in one location. This is called co-located care. As we continue in this course, keep in mind the definition of behavioral health. Behavioral health is an umbrella term that includes mental health and substance abuse conditions, life stressors and crises, stress-related physical symptoms, and health behaviors. Behavioral health conditions often affect medical illnesses and vice versa. What is patient-centered care? Patient-centered care is care that places the patient at the center of the entire team. And integrated care is a strategy that allows that to happen. It prioritizes the needs and desires of the patient over what the doctor thinks is best. Recently, the term person-centered has been used to emphasize that care must include all parts of a person's life. The Agency for Healthcare Research and Quality, abbreviated AHRQ, Academy for Integrating Behavioral Health and Primary Care, is the leading resource for practices and people who are working to provide integrated care. Their definition of integrated care is a complex and long one, but I'm going to read it and then we're going to break it down. Integrated care is the care that results from a practice team of primary care and behavioral health clinicians working together with patients and families using a systematic and cost-effective approach to provide patient-centered care for a defined population. This care may address mental health and substance abuse conditions, health behaviors, including their contribution to chronic medical illnesses, life stressors and crises, stress-related physical symptoms, and ineffective patterns of healthcare utilization. I think they also want to throw in the kitchen sink, eh? No, everything is in here. But what's beautiful about this definition is it's really starting to help us think about what paraprofessionals do, is look at the whole person and recognize that everything is connected. So let's break this down a bit. First, care that results from a practice team of primary care and behavioral health clinicians working together with patients and families. What does that really mean? We can translate that into the idea that every patient has a team of healthcare professionals that includes medical and behavioral health providers, and patients and family members are partners who make decisions about their health care. Second thing that AHRQ tells us is that this system of care uses a systematic and cost-effective approach to provide patient-centered care for a defined population. In essence, in practice, that means that the healthcare practice has a system in place for providers to develop a care plan with the patient, share it with the care team, and follow up with the patient to track progress. And that doesn't happen just occasionally, but every patient who walks through their doors receives these 3 steps in care. The care plans may look different, but it's systematic and it's done for every patient. Care may address mental health and substance abuse conditions, health behaviors, including their contribution to chronic medical illnesses, life stressors and crises, stress-related physical symptoms, and ineffective patterns of healthcare utilization. That's an awful lot, but essentially what that's saying is that care is comprehensive. It recognizes that a person lives with a whole bunch of different influences on their life, and that the integrated care practice is going to address all of those influences so that person can experience the best, healthiest life that they can. So, and the team members respond to all of the patients' and families' needs. Integrated care means that every patient has a comprehensive plan for their health and a team to help him or her get there. The goal of integrated care is better health for the whole person. So what's different about integrated care from the way that healthcare is normally prescribed or delivered? I'd encourage you to think of integrated care as a strategy to improve people's health. As a strategy, it is a way to do something. It replaces old models of healthcare delivery in which patients received care from one or more medical providers and one or more behavioral health providers, and no one talked to each other. So it's one of the reasons we got into trouble with overprescribing of pain medications. 3 different prescribers. Patients could doctor hop. So what we're working with the integrated care model is assuring that everybody knows what everyone else is doing to care for this patient. Paraprofessionals in integrated care. Paraprofessionals, including peer support workers, community health workers, community prevention specialists, all of you guys who are out there doing this awesome work are really essential team members in the integrated care model. Even though AHRQ does not mention you, which makes me really angry, you guys are really the heart of it. You help patients navigate healthcare systems, address social drivers of health, such as housing, utilities, transportation, access to healthful foods, and more, building the basis so that when the clinician prescribes a medication or a treatment or something, the person's actually able to follow those instructions. Some of the issues commonly addressed in the integrated care setting include depression, anxiety, and other mental health problems, substance use problems, behaviors that worsen or increase the risk of chronic health conditions such as asthma, diabetes, or high blood pressure, physical problems, of course, stressful life situations or crises, and finally, preventing the use of emergency departments, urgent care, or hospitals, which are, of course, the most expensive way to deliver care. And also, it means that somebody's really sick by the time they get there. By making sure that people can regularly and early get access to primary care and mental health services. So if this sounds like a fairy tale of healthcare, it may be, but it's a fairy tale we're all growing. So what do you need to have to build? What's the magic dust that we need to put into our fairy tale? First of all, a system. I've already referred to this once, but I want you to really learn this one because it's probably the heart and soul of the integrated care model. A system that assures that there are 3 steps taken for every single patient. Number 1 is develop a care plan with a patient. 2, share the care plan with the care team so everybody knows. And finally, follow up with the patient to track their progress. Providers recognize that So what is needed for integrated care? I'm going to start with the idea part of that, the belief systems. First of all, we need providers who recognize that medical, including oral, and behavioral health are part of overall health and well-being. All of the providers on this team need to buy into that model. They need to understand the relationship between the two. All team members need to have a willingness to actually work together toward the overall health goals defined with the patient. Frequent communication is an essential part of teamwork, and we'll talk a lot more about that. And finally, coordinated efforts. All of the providers need to be coordinating and talking with each other so that everybody knows what the other one's doing. What are some of the benefits of integrated care? First, by integrating services, healthcare organizations can provide more comprehensive care that meets the needs of the whole person. Integrated care also brings huge benefits to patients, providers, healthcare organizations, and communities. Let's look at each one of those categories. First of all, the benefits to patients. The patient's needs are addressed comprehensively and proactively. It helps to prevent worsening of conditions, and it helps them often to turn the corner knowing that if my doctor told me I need to walk more, I also have the psychological, the emotional, the spiritual, the practical support to actually start walking more instead of it just being another doctor's order that I'm not going to follow. They've got easier access to care that they need. If someone walks into a primary care clinic in need of mental health services, they can easily, with a warm handoff, be walked across the hall and introduced to somebody who can help them. The paraprofessional can help facilitate that care, access to care and to other services. And they receive support for social factors that impact health. Again, often largely the role of the paraprofessional as well as the nurse case manager. It also breaks down the arbitrary line that somebody made up someday long ago with a story that there's a real difference between physical and behavioral disorders by recognizing that the two are intrinsically linked. Somebody decided to categorize some different one, and we've lived that way ever since. Integrating care is trying to pull them back together. Healthcare organizations and providers also benefit greatly. They are able to provide higher value care. And there's a lot of financial incentives around that. That when they can provide higher value care, they'll even get better reimbursement rates from many of the payers. Not to mention that they're part of the solution. For stressed primary care and behavioral health systems, a team-based approach to integrated care allows every employee to work at the top of their scope. That means that everyone on the team is able to do their maximum. So that allows the primary care physician's knowledge and skill sets to expand. It means that they can better recognize and treat people with mental health conditions. Vice versa, mental health professionals improve their abilities to recognize the psychological effects of physical conditions and vice versa. Communities also benefit. And the bottom line is, if residents are healthier and more productive, the workforce is stronger, the community's happier, crime goes down. People do things that make communities stronger and more beautiful and more productive, just make life better. Secondly, integrated care models provide jobs for people. There are jobs in the clinic, jobs, it's a positive economic spiral that can occur. And once again, back to the paraprofessionals, the community health workers, the peer support workers, the community support workers, all of you guys out there. You make these benefits possible. You are the thread that sews the care together by connecting the dots. When you help patients to make medical and behavioral health appointments, link them to social services, legal services, housing, education and employment, food pantries, and more, you're making a real difference in those people's lives and making it so that they can actually benefit from the medical care and the behavioral and the mental health care that they're going to receive. It's really hard to benefit a lot from that care if you go back out on the street and you're homeless. You help the benefits become more possible when you accompany the patient during a visit and act as a health coach to help interpret the provider's diagnosis and treatment instructions. So often people can't hear what the provider is saying. Either there's a communication gap, or someone might be so stressed because of a not so happy diagnosis that they can't hear and respond. So in your role as being that extra set of ears and eyes, you can really help people to move forward and make better use of that care. Providing training and education to patients and families. You can help them learn so much about reading a nutrition label or trying to monitor one's mood. There's so many skills that you have. And vice versa. You're also an integral liaison to other team members, clinicians who might not be from the community or the culture, who might not understand what it's like because they haven't been there. So you can help other team members to better understand patient stories, cultures, and needs. Let's take a moment to listen to a short video from a man who actually directs a large mental health system in California and his own experience with integrated care. What are some of the challenges to integrated care? First challenge is traditional separation. Traditionally, medical and behavioral health care have been provided separately, as anybody who has ever run from one physician's office to another. Funding streams for care are often separate, offices are separate, and clinicians rarely talk with each other. That's been the kind of island model of healthcare that we've been used to. Often, behavioral health disorders are seen as secondary in importance to physical ailments. And finally, substance use has been treated as a crime, not a disorder. All of those things challenge so much of what we're trying to do by bringing together care into one comprehensive whole system. Workforce training. Healthcare workers train in silos. That is, they receive most of their training without interacting with students or professionals in other healthcare occupations. Doctors train, nurses train, and even at higher levels of specialty care, the cardiologists go off and do their thing while the general practitioners do something else. So there's a lot of separation in training. And physicians especially may have little idea about a paraprofessional's or other colleagues' scope of work. Mental health professionals and primary care professionals may have been trained to address the same problems in different ways. They may use different language to describe the same thing. That, of course, can lead to a lot of confusion. Sometimes also health literacy across the team becomes an issue. Clinicians may use very specialized language to communicate, and that specialized language might not be part of the paraprofessional or the medical assistant's training. So if you ever don't understand something, just ask. It's their responsibility to communicate clearly with patients and with you. Another challenge is workforce tension. Sometimes in these settings, people can feel like they're getting their toes stepped on. So some healthcare workers may feel threatened by other professionals and paraprofessionals on the team. Disagreements may arise about the best course of treatment for a patient. What's the best thing to do? Another challenge is limited information technology. Integrated care really rests on some of the information technologies that we spoke about in the Digital Health Technologies course. But despite years of investment, proven efficacy, and incredible promise, not all healthcare practices have fully implemented information technologies and trained their employees to use them well. Integrated care is the most efficient when supported by seamless, interoperable health information technology systems that facilitate information sharing and care coordination. Now, since you guys have taken the Digital Health Technologies course, I know you know what that means. Challenge expectations of patients and families. Just as providers expect care to be delivered piecemeal, patients and families have been conditioned to expect that medical care and behavioral health care be delivered separately. So, especially if you have a complex patient, they may go to 6 different doctor's offices just to receive the care they need. And finally, the stigma associated with mental health treatment may lead to reluctance to pursue treatment. That stigma may be especially strong in certain communities. And so one of the beauties of integrated care is if it's all under the same roof, it's truly a co-located advanced model. It's not so hard. Nobody sees you walking into that mental health care facility. And people often feel very embarrassed about that. Finally, funding. Much of the work done in integrated care has been done on what's called soft money. That is grant-funded work. And so when the money runs out, the backbone of the integration, the administrative piece, all that stuff is no longer there, even if you have teams who are ready and willing to perform the tasks of integrated care. And because grants are really focused on specific objectives, we're going to create this curriculum, we're going to do this training, we're going to serve X number of people. That's all, that can sometimes take over the whole real purpose of it, which is really system-wide change. So here's a quick lesson summary, just to recap what we've just covered. What is integrated care? Integrated behavioral health care brings together all of the healthcare workers who are caring for a patient into one team to address the patient's medical, behavioral health, social, and other needs. The goal of integrated care is better health for the whole person. Integrated care is a strategy to improve people's health. At its best, integrated care is bidirectional. Paraprofessionals, including peer support workers, community health workers, and others, are essential team members. What is needed for integrated care? Practices that provide integrated care have a system in place that can do the following 3 things. Put them up on your wall, put it on your bathroom mirror. Learn these 3 things. Develop a care plan with a patient. Share the care plan with the care team. Follow up with the patient to track their progress. Every patient, every time. Summary: benefits of integrated care. By integrating services, healthcare organizations can provide more comprehensive care that meets the needs of the whole person. Behavioral health paraprofessionals support patients and their families and help other healthcare team members to better understand patient stories, cultures, and needs. Behavioral health paraprofessionals make the benefits of integrated care possible. Challenges to integrated care include traditional separation of medical and behavioral health care, workforces that train in silos and receive little training in teamwork, tensions that arise when healthcare workers feel threatened by other professionals and paraprofessionals on the team, limited information technology, expectations of patients and families for care not to be delivered in an integrated way, and lack of sustainable funding. Thank you for your time. This lesson was developed as part of the integrated care curriculum by the Grow Our Behavioral Health Workforce Program of the Center for Health Innovation with funding from the Health Resources and Services Administration.